Alright, I'm ready. I'm going to do a nasotracheal suctioning. So the first thing I'm going to do is check the patient's chart, see if they have had a surgery or anything from nose, just to make sure so that way we don't hurt them anymore or anything like cause any damage to them, their nasal area. So the first thing I'm going to do is going to knock on the door, introduce myself. I'm going to wash my hands. I'm going to make sure I have the appropriate PPE with me, especially the gown. Cap, we can wear a face shield just in case if there's any splashing, and then the appropriate gloving. So I'm going to go ahead and apply some gloving with my PPE on, just so that I'm ready to go. And then I'm going to get everything ready. So you can use a nasal trumpet, or you don't have to if they don't have it present. So we're always going to place and measure a nasal trumpet for the patient after we've checked everything, make sure their vital signs are good, and listen to their lung sounds before we do anything with suctioning out the lungs, anything like that. So we can take a couple sizes with us just to make sure we have the appropriate size. So you would measure from the earlobe to the nostril here, so that way we can see if it's appropriate fit. And you can also check by the bevel here. So when you're ready and you find the appropriate size, you can lubricate the end, that way it goes in easier and it doesn't hurt the patient. And always, before you place anything in the nose, always check the septum, always make sure nothing is wrong, no signs of any abrasions, anything like that that can cause bleeding, anything like that. So then once we're ready, we would always place the bevel towards the middle of the nose, and you just slowly place it in like that. And then I would get everything ready. So first I would go ahead and I can set up the suctioning kit. And I can make sure this is working properly, so you can include the ending piece. So you want to be -20 to 150, -150. So if it's over -150, you can always turn it down to get the appropriate suctioning that you need. And I'll get always want to hyperinflate their lungs, so I'm going to connect an oxygen device to them. And as always, especially with the sonographer breather mask, you always need to make sure this the bag inflates there. And then you'll place it on here, so that way the lungs can hyperinflate. And then I'll get my supplies ready. So then I will open up my kit. I'll have some lubricating jelly. I can place it on the lid of the basin here, or I can also put it on clean gauze. I'll get my gloves ready. Always have them open, ready to go. Then I place sterile water into the basin. That way it re-sterilizes the catheter. Make sure it's nice and clean before we place it into the patient. And then when we're ready, you can either take off your gloves and wash your hands, or you can place the sterile gloves over top of your gloving here. So I'm going to go ahead and place it on. Try not to touch anything on the outside of the sterile gloves, like that. So then when you're ready, we can go ahead and grab our tubing with this hand. So you always want to make sure there's no kinks or anything in the tubing when you get this out. And I'll take my sterile hand to grab the catheter. And what I'll do is I'll place it into here, make sure I start hearing the hissing sound. And then I'll take the end of this and I'll place it into the sterile water to make sure I suction up plenty enough water in there, make sure it's working properly. And then I put the lubricant there. And then if I have it on clean gauze, then I'd go on the clean gauze and I'd wipe it onto there and get the lubricant on there. And sometimes the doctor will have needing a sample, so I place extra tubing here to get that sample. So when I am ready, I will remove the oxygen from the patient. I will set it off to the side, and then I will slowly enter into the patient's nose. until I feel that there's a stop, then I can always slowly go back. So you want to suction for about less than 15 seconds, no more than 15 seconds. So when you're ready to come out, you will slowly work your fingers down to the end so that way we don't cause any splashing on the patient or anything, and sometimes we can drape something over them so that way it does not get onto them. So then if we have to do it again, so we will oxygenate the patient, make sure that hyperinflates their lungs again, but then if we are finished, if we don't need to do anymore, then we will wrap this around your hand like this. Take it on the suction catheter there very carefully. Then I would remove and dispose of it. And then I can place this over here. That way it doesn't touch the floor or anything. Remove the rest of the PPE. I can remove my PPE or I can leave it on until I'm finished with everything, but I want to wash my hands, apply gloving on again. And then I'm going to reassess the patient. I'm going to check the patient's vital signs, make sure they're doing okay after I did a suctioning treatment especially. Listen to their lungs to see if I cleared out some of those secretions, make sure it's helping the patient out. And then always check the oxygen, make sure they're doing okay with the oxygen. And then once they're finished, we can shut off everything. We can shut off the machine. Then we can, if they're finished with the oxygen, we can shut this off and remove it and set it in the appropriate area, so that way if we need a suction again, we have it ready for us. But otherwise, we will remove anything that we have used, clean off anything, like sanitize the table if we something on countertop here, and then we will go and chart on the patient's charts and let any of the staff know that needs to know about the nasotracheal suctioning.